Worrying about the pain that you might feel during labour is to be expected. I'm Lizzie, an antenatal hypnobirthing teacher, and I'm a mum too. In this video, I'll share with you some different techniques that you can use to increase your comfort levels so that you can manage the powerful sensations of birth as best as possible. Birth is effectively the work of your amazing uterus muscles. Your uterus is made up of horizontal muscles and vertical muscles, and together they release and draw upwards to allow your cervix to gradually open up to about 10 centimetres. Understanding that that's where the pain is coming from during birth can really help you to manage it. But please know that there are so many different things that can increase your comfort levels as well. Let's chat through some of these. Dr. Grantley Dick Reed, an obstetrician in the early 1900s, discovered that tension caused by fear can really influence the pain that you might feel because your uterus muscles are having to work a lot harder. Hypnobirthing is an antenatal method that is based on this scientific theory. It works on reducing any fears and anxieties you may have around labour so that you can instead approach birth feeling calm and positive. Knowing a range of relaxation techniques can help you to break this fear, tension, pain cycle. But relaxation is a skill that takes practice. By starting practicing relaxation now during pregnancy, it will be able to come so much more naturally to you during your labour. One of the simple relaxation techniques we teach in hypnobirthing is called calm breathing. It involves taking a deep breath in through your nose for the count of 4, and letting it fall gently out of your mouth for the count of 7. The idea of this is to help trigger relaxation in your body and reduce any tension that you may be feeling. This is how you might use calm breathing. By doing at least 4 repetitions of this should be able to get you through a contraction during labour. It gives you something to focus on rather than the other sensations that you may be feeling. Other tools that you can use to promote relaxation is listening to music. You might create a labour playlist for yourself of songs that you and your birth partner enjoy listening to. You can also use essential oils such as lavender, which promote relaxation. One of the most effective ways to find comfort during labour is the use of warm water. This might be in a birth pool or simply taking a warm shower. Many women who have used a birth pool have reported feeling less pain and overall a greater sense of control. For most women who haven't given birth before, we often imagine ourselves laying on our backs to give birth. And that's because that's what we tend to see on TV. But quite often, the easiest and most comfortable position to be in is in a UFO position. That stands for being upright, being forward, and open. Positions might include being on all fours, leaning over the side of your bed, bouncing on your birth ball, or even stood up leaning against your birth partner. In positions like this, you are allowing gravity to help you, and you are also maximising the space inside your pelvis to give your baby the most room as well. Start to imagine or even practice yourself in these different positions so that it feels a lot more natural to you during labour. The art of distraction can be incredibly effective during labour, as although our mind is very clever, it can only focus on one powerful sensation at a time. A TENS machine can be bought or hired during labour. You attach sticky pads to your lower back and it sends electrical impulses through to your nerves, which can give you a little bit of a tingling sensation. This can be really effective during a contraction to distract you. A great way for your birth partner to be involved and help you manage these contractions are by giving you a massage. This could be soothing strokes or more firm pressure on your lower back to help you keep your mind off those contractions. Finally, some women like to use a comb during labour. By gripping it into your hand with the teeth facing inwards on certain pressure points, it again distracts you from the powerful sensations of birth, but it also releases endorphins, which is your body's own natural pain reliever. It is really reassuring to know that your body has that natural pain reliever of endorphins in it, and it's said to be a couple of 100 times stronger than morphine. However, if pharmaceutical pain relief is something that you know you might want, do your research now to see what is available for you in your chosen birthplace. This may include gas and air, oral drugs such as codeine, opiates like pethidine, or an epidural. It is really important for you to be able to make an informed decision about the pain relief you choose. There are pros and cons to all of them. While the thought of instant pain relief might be reassuring, it is worth knowing that with some of these pain relief drugs, the chance of needing further intervention can increase. As always, the options that you have for pain relief can be discussed with your midwife. I hope you have a really positive birth experience.